Assalamualaikum and salam sejahtera. I'm Filzano binti Asari, Senior Microbiologist from Institute for Public Health on behalf of Dr. Chong Zulin, would like to present an interesting topic on diagnostic accuracy and utility of 3 dengue diagnostic tests for the diagnosis of acute dengue infection in Malaysia. As we know, dengue threatens a pandemic with the spread of Aedes mosquito, the vector that carries the pathogen dengue virus that comes in 4 serotypes to subtropical regions throughout the world. In Malaysia, dengue incidence stood as high as 396.4 cases over 100,000 population, with case fatality rate ranging from 0.2 to 0.28% in recent years. Despite an absence of medical treatment to date, early disease recognition and timely intervention with proper fluid management and supportive care can prevent mortality due to dengue infection. The growing demand of dengue diagnostic, especially in low-resource settings, gave rise to many rapid diagnostic tests. This study evaluated the accuracy and utility of 3 dengue diagnostic tests. 3 index tests were Virodengue Acute, Semi-Quantitative Immunomagnetic Agglutination Assay, and SD Bioline Dengue Duo Rapid Immunochromatography. These are RDT intended for point-of-care use, and the third index is SD Dengue NS1 antigen using ELISA method. This evaluation study employed a prospective cross-sectional design. Its reporting followed standards for the reporting of diagnostic accuracy studies, START guidelines. The study site was Shah Alam Section 7 Health Clinic, a public health clinic with the highest number of dengue endemic district of Petaling, Selangor. Febrile patients aged 9 months and above with symptoms fulfilling WHO 2009 criteria for suspected dengue that sought treatment at this clinic from 13th November 2017 to 30th March 2018 were recruited. Both capillary and venous blood samples were collected from each patient for index tests, and venous blood was used for reference tests. The reference tests comprise of ITEC Universal SYBR Green One-Step Real RT-PCR, Pan-Biodengue ELISA, and SD Dengue IgM and IgG Capture ELISA. This flow chart showed the result from 490 patients that fulfilled the criteria. From 490 samples tested, 227 were positive, 262 were negative, and 1 was inconclusive. From the positive sample, 155 were laboratory confirmed and 72 were presumptive. A laboratory confirmed dengue was defined as RT-PCR positive or Pan-Bio NS1 ELISA positive, while a presumptive defined when dengue tested negative for both the above, but positive for IgM ELISA. Patients who did not fall into any category above were taken as dengue negative without further laboratory tests. Among NS1-only assays, the sensitivity of NS1 ELISA from SD was significantly higher than its own RDT at 66.5% versus 52.4% respectively. When the result of all 3 individual assays on SD Bioline Dengue Duo were combined, where positive on either one was considered as dengue positive, the diagnostic accuracy parameters generally improved. The specificities were rather comparable, with SD and S1 RDT performed better significantly at 97.7%. There was no significant difference between all 3 NS1 tests for the other parameters. Similar to the trend observed before, all NS1-only assays and SD and S1 IgM RDT were more sensitive in the detection of laboratory confirmed over presumptive dengue. On the contrary, both serology-only assays perform significantly better in detecting presumptive over laboratory confirmed dengue. Although a positive test on any of the NS1 assays would increase the probability of dengue to above 90% in a patient, a negative result would only reduce this probability to 23 to 29.3%. In contrast, this probability of false negative diagnosis would be further reduced to 14.7% if SD bioline NS1 IgM IgG combo was negative. The performance of viral tract dengue acute was comparable to SD dengue NS1 antigen ELISA. Addition of serology components to SD bioline dengue duo significantly improved its sensitivity and reduced its false negative rate such that it missed the fewest dengue patients, making it a better point of care diagnostic tool. New RDT like viral tract dengue acute may be a potential alternative to existing RDT if its combination with serology components is proven better in future studies. With that, thank you for listening.